So let me be real with you. When someone comes to me with fatigue, anxiety, or even bloating, I don't ask, how do I get rid of this symptom? I ask, what system is struggling? In fact, in the US, over 70% of doctors' visits are for chronic symptoms alone that never get resolved, just managed with pills, according to the CDC. And that's because most providers are trained, conventional allopathic providers are trained only to treat symptoms, not get to the root cause. No matter how many times you go to a conventional doctor, that is not their training. They are there to diagnose, which is just a label, and then manage that diagnosis. And that diagnosis is pretty much generalized, right? So there's no specifics, there's no nuance. So we keep looking for the conventional community to have all the answers, and unfortunately, they don't. In holistic medicine, we study systems, and conventional doctors are not trained in holistic medicine. So stop going to your conventional doctor looking for them to be a holistic doctor. Go to a holistic doctor because they're trained. We are trained in studying systems because that's actually where healing begins. If you're new to my channel, welcome. My name is Dr. Erica Steele. I'm a board certified naturopathic doctor. I hold 7 degrees in my field, all in the natural healthcare space. I like to say that I went to school so you don't have to. And I'm also the founder of Holistic Life App, a remote monitoring tool where you can begin to monitor your health, but also it's a part of our Intro to Holistic Medicine class where we teach you how to look at your health from a systems approach. It's a completely free course. You just click the link in the bio, scroll down, and it'll say enroll, fill out the form, and away we go. If you're ready to stop chasing symptoms and start understanding your health at that root level. I know we give a lot of lip service to root cause, but this is truly root cause medicine. So it's free, it's built to guide you step by step, it's self-paced so you can jump in. All right, so a symptom is like a smoke alarm. If you don't turn off the alarm and assume the fire is gone, you look for what's burning. And that's what I do with fatigue, pain, hormonal issues, digestive concerns. Every symptom is just a symptom. It's a signal. It's just the body telling us that something's going on. And so instead of asking, what do I treat? Like whack-a-mole, right? All the symptom chasing, I ask, how's your digestion? How's your sleep? How's your water? Is your nervous system regulated? Is it toned? What's going on with your detox pathways, your mitochondria, your mineral reserves? That's how I build a personalized care plan, by mapping out the terrain and not chasing pain or symptoms. So as an example, somebody with, let's say, skin breakouts like eczema or things like that might get an antibiotic or a topical steroid cream from a conventional provider. That again does nothing. All it does is suppress the symptom and push it deeper into the cell wall. But I'll look at, let's say, liver detoxification function, or small intestines, or the gut microbiology, or hormone rhythms, or emotional stress, or trauma storage, because it's not about the skin. The skin is just expressing, it's actually a secondary drainage pathway. So it's expressing toxicity. It's about the system, right? It's about looking at which aspects of your system are broken down. And so that's what real holistic medicine looks like, not just throwing symptoms at the problem like a conventional doctor. Even a lot of times, conventional doctors who call themselves holistic doctors with no training will often just throw supplements at the problem, not really addressing the root cause. And I don't match symptoms with supplements. That's a conventional medical model, a pill for every ill. The way that the systems actually work is we look at the systems that are weak, we support those, and then match symptoms with what we need to work on. I don't work in shortcuts. Again, I work in systems. So your care is sustainable and not just symptom focused. And while we're doing that, I'm teaching you along the way so that you can maintain it. So eventually you don't need me anymore. That's why I love public health so much, because I get to teach my patients one step at a time what they need to do. So if you're tired of treating the same problem again and again and again, managing symptoms like whack-a-mole, maybe it's time you stop looking at the symptom, which is just the problem, and start understanding the pattern, because that's really what holistic medicine does. It looks at the pattern, it looks at the systems, and it sees the relationship. And that's what I teach. And that's what we do inside my programs every single day. So if you are interested, you can join us for Intro to Holistic Medicine. We are in week 9. However, it is self-paced. You can join anytime, and I'll walk you through how to shift from that symptom-focused management into more of a system-guided care, because we want to start healing from the inside out. A lot of times it comes from the deep organs all the way out. So drop a comment below. What's one symptom that you're absolutely tired of chasing? I'd love to get some insight from you. And remember to like, share, subscribe, and comment for more.